Welcome. In the last session, I discussed about pectoral girdle. So we were studying about these girdles, right? And these girdles are of two types: pectoral and pelvic girdle. Okay. So in the last session, we already discussed about this pectoral girdle. So in this session, we'll see about pelvic girdle. About pelvic girdle. So here, this pelvic girdle, so it consists of two coxal bones. So it consists of two coxal bones. Okay, and each coxal bone is formed by fusion of three bones. Fusion of three bones. So what that three bones? The fusion of three bones. One, it is ilium, and second one is ischium, and third one is pubis. So all these three together form the coxal bone, and you find two such coxal bones. Now here, the point of their fusion, the point of the fusion of these three bones, okay, on a side, it produces a cavity. So here the point of fusion of all these bones results in the formation of a cavity, and that is called acetabulum. Is called acetabulum. So this acetabulum is a point where the head of the femur fits into it and forms the ball and socket type of joint. Now I'll show you the picture of this coxal bone and see the parts of it. Right. So this is the picture of pelvic girdle. Right. So in this, I said it is composed of two coxal bones. So each coxal bone, it has three parts: ilium, ischium, and the pubis. So here, so that is, of course, this is pubis. Okay, so here I will show you. Okay, in this, so this portion, right, it is the ilium. So the portion is called ilium, and here this one, okay, is called iliac crest. It's called iliac crest. Okay. And next, so here this portion is the pubis. Okay, and this is the ischium. It's the ischium. Okay, so you have ilium, okay, the pubis and ischium. So this part all together will form, okay, one coxal bone. So this coxal bone is also called hip bone. So coxal bone, or also called hip bone. Coxal bone or hip bone. So you can see here all this one. So from this point, okay, so all whichever I am just mentioning with the line. Okay, so this is, okay, one coxal bone, and you say see another same on the other side. So this is an another, okay, right, coxal bone. So these are two coxal bones, and you see here on this top, so this is the point where the vertebral column sits, and this part what you are seeing here, okay, so this portion up to here, so this is the sacrum. So you can see it is a fusion of vertebrae. Okay, so this I'll mention vertebral column. So vertebral column, okay, sits on this here, and this one is, okay, sacrum. So this is sacrum, and now below that you find a small, okay, portion only, okay, this one. So this is what we call it the coccyx. So that portion is called the coccyx. Okay, so you can see this sacrum, which is a fusion of 5 vertebrae, and coccyx, which is a fusion of 4 vertebrae. Okay, so the tailbone, you can see the difference between the coccyx and the sacrum. Now these two coxal bones are, okay, joined, okay, at one point, and this here you see a small blue colored one, okay, between the two coxal bones is called pubic, okay, symphysis, is called pubic symphysis, and this contains a fibrous cartilage, contains fibrous cartilage. Okay, right, and you see a small hole, okay, here between the pubis and ischium. So this is called obturator foramen, is called obturator foramen. So this is the obturator foramen. Okay, right. So these are the parts, okay, of the coxal bones, and here one more point. So you find a small cavity here. So you can see here a small cavity. So this is a small cavity here. So this is a point where all these the ilium pubis and ischium, they fuse together, and this is the one which results in the formation of a cavity, that is what we call it acetabulum. It's called acetabulum. So that portion is acetabulum. Right, so these are the parts of this pelvic girdle. So I told you that acetabulum is a point where the head of the femur articulates. So acetabulum is a, okay, where the head of femur articulates. So it fits into this acetabulum and give it a ball and socket type of joint. Okay, right. So that's all about the girdles. Now we will see joints. So the next one we shall see about joints. And these joints are of three types. One we call fibrous joints. Then another type called the cartilaginous joints, and one more called synovial joints. So coming to these fibrous joints, we have further classification under fibrous joints. We have is sutures. Okay, so and then one more type we have is Syndesmosis, and one more type we have is Gymphosis. So when we see out of these sutures, syndesmosis and gymphosis, okay, so here these sutures are immovable joints. So these are immovable joints, they don't show any kind of movement. And coming to syndesmosis, they show a slight movement, so these are slightly movable, slightly movable. And coming to gymphosis, these are also immovable, okay, joints, called immovable joints. So here we use a word for immovable joints. Okay, so all those joints that are immovable, so which means we use synarthrosis. Okay, synarthrosis. Okay, coming to, okay, this syndesmosis, so slightly movable. Okay, slightly movable, we use a word called amphiarthrosis, right? So here the sutures are synarthrosis. So as I said, it is immovable joint. Sutures are synarthrosis, whereas syndesmosis are amphiarthrosis, whereas gymphosis are also synarthrosis. So this is about three types of fibrous joints here. Okay, so I'll give the examples later. So here we'll see coming to the cartilaginous joints. So these cartilaginous joints, we have synchondrosis, synchondrosis, and we have one more, symphysis. Are two types of cartilaginous joints. And coming to the synovial joints, the synovial joints include ball and socket type, okay, of joint. So I'll say ball and socket joint, ball and socket joint. The next another one, hinge joint. The next one, pivot joint, pivot joint. Then the next one, gliding joint, gliding joint. The next one, condyloid joint, condyloid joint. So these are okay, different types of okay, synovial joints. So three types of joints. Okay, so that is fibrous joints, then cartilaginous joints, and synovial joints. Now let us see one by one. So first we'll see about the fibrous joints. So let's see the first type of joints, fibrous joints. So under these fibrous joints, we'll see about first sutures. So these sutures are, as I told, they are immovable joints, and you can see these sutures which are present between cranial bones, present between cranial bones. Okay, so example for these sutures are coronal suture, the coronal suture, which is present between frontal and parietal bones, between frontal and parietal bones. Here I'll show you a picture of it. So here is the picture which I am showing, okay, of the skull. So here in this skull you can see this is the frontal bone. So this is the frontal bone, and you can see here this is the parietal, and this is also the parietal bone. And you can see between the frontal and parietal bone, so you find an, okay, a zigzag suture. So this is what we call it the coronal suture. Okay, so you will find a zigzag joint here. Okay, so this is a coronal suture, and in the same way you find between the two parietals also the sagittal suture. So all these are examples that come under these sutures. And another one, okay, you see, okay, lambdoid suture, then squamous suture. So all these examples that come under, okay, these sutures. And the sutures are immovable joints. So these are immovable joints. Okay, so that's about the sutures. Then next we'll see about syndesmosis. So the next one is syndesmosis. So this syndesmosis, as I told, that these are slightly movable. So there will be slightly movement in them. So example for this syndesmosis is interosseous membrane between tibia and fibula. So between, okay, tibia and fibula. Okay, so you can also call this interosseous membrane as right, middle tibialo fibular ligament. So you can also call it middle tibiofibular ligament. So let's see a picture of it. So let's see here, this is the picture, okay, where I'm showing you the tibia. So this is the, okay, main bone, and the supporting one you can see here. So this portion, so where you see here, okay, so this is the fibula here, and this is the tibia. So where I'm drawing the membrane, okay, so you can see here, right. And now in between these two bones you can see the interosseous membrane. So this is what we call a syndesmosis. It's a fibrous joint. Okay, so that's about syndesmosis. Next we'll say about uh, gomphosis, the third type under fibrous joints. So another one are the gomphoses. So these gomphoses are also immovable joints. So it's a immovable joint, and we see this one at the dento-alveolar joint. So this dento-alveolar joint binds the teeth to the bony teeth sockets, binds to bony teeth sockets in maxillary bone and mandible bone. So we know that maxillary bone is the upper jaw and the mandible is the lower jaw, and we have the sockets in those bones. So the sockets which, okay, which fit into that will be the teeth. So here that socket, right, and the teeth, the joint between them is what we call the dentoalveolar joint. So that's all about the types of fibrous joints. Now let's look at cartilaginous joints. So the next one, cartilaginous joints. So under this we have two types. Okay, when we have chondrosis and symphysis. So here these cartilaginous joints, so these joints, okay, will have cartilages. So the joints have cartilages. Okay, so now let's see the first one, synchondrosis. Synchondrosis. Okay, so here this synchondrosis we see between the epiphyseal plate. Okay, so this epiphyseal plate is the synchondrosis, right, and this is present between, okay, epiphysis and the diaphysis. Okay, so when we see the bone, so especially the long bones, okay, so here there will be a region of differentiation. Okay, so this epiphyseal plate is the one that actually helps in growth. Okay, so when the person is growing, so you will see a clear mark, okay, that's called the epiphyseal plate. So once the growth stops, it gets completely fused and you may not see much difference between. Okay, so here between the epiphysis and diaphysis. So this is epiphysis and this portion is diaphysis. Again, this is also epiphysis. Okay, so between epiphysis and diaphysis you find this, okay, epiphyseal plate. That is an example for synchondrosis. Okay, so this is also a immovable joint. It's a immovable joint, so hence you can call it as synarthrosis. So it's a synarthros joint. The next one, symphysis joint. So here just now in the pelvic girdle we have seen this. The symphysis joint you will see in case of this pubic symphysis of pelvic girdle. Pubic symphysis of pelvic girdle, and this symphysis is slightly movable. It is slightly movable, hence it is called amphiarthrosis. It's called amphiarthrosis. Okay, so that's all about the cartilaginous joints. Now let's see about the synovial joints. So the next one are synovial joints. So these synovial joints are freely movable joints. So hence these are called diarthrosis. Okay, so already I have mentioned, right, if it is completely immovable, okay, synarthrosis. Okay, completely immovable, which means synarthrosis, then slightly movable, I call them amphi, okay, arthrosis, and then okay, freely movable. So these are called the diarthrosis. Okay, right. So these are the synarthrosis, amphiarthrosis. The difference between, okay, them. So here these synovial joints are freely movable joints, and we call them, okay, the diarthrosis. Now these actually the joints are covered by a double layered synovial capsule, covered by a double layered synovial capsule. Okay, and in this case the outer layer will be consisting of dense fibrous irregular connective tissue. So it consists of dense fibrous irregular connective tissue. So this dense fibrous irregular connective tissue will form the outer layer. From the outer layer, this will contain a high content of collagen. So this consists of high collagen content. Okay, the next one, okay, uh, the inner layer, and this inner layer, it consists of areolar tissue and elastic fibers. So it consists of areolar tissue and elastic fibers. So this will constitute the inner layer. So the synovial capsule, so this synovial capsule, it has two parts. One, it is the dense fibrous irregular connective tissue, and another one we have is the areolar tissue and elastic fibers that constitutes its inner layer. Okay, so this areolar tissue secretes a viscous fluid. So this areolar tissue, so it secretes a viscous fluid. Okay, so that's what we call it, the synovial fluid, called synovial fluid, and that fills up the capsule. And this synovial fluid, the synovial fluid, it consists of hyaluronic acid. So it consists of okay, hyaluronic acid, and it also has phagocytes, etc. will be seen in this synovial fluid. And this synovial fluid will act as a lubricant. It acts as lubricant for, okay, the free movements of the joints. Okay, right. Now here, coming to this the outer layer. So this outer layer will be in continuous with the periosteum. So periosteum is an, okay, layer that covers the bone. So it's a membrane that will be covering on the bone. So we will find a layer on the bone. So this is, we call it periosteum. Okay, so this is the bone. Okay, right. We'll see now different types of synovial joint, and before that I'll show you a picture that shows how the synovial joint is present. So let's see in this picture. So whatever here you see, this is the, okay, uh, the layer that covers the bone. It's called periosteum, and this is the synovial capsule, and that will have, okay, the synovial right membranes, right, the outer and inner. So the synovial capsule, you can see this, okay, and this is the synovial capsule, right, and here you have a cartilage. So this is a cartilage that will be present at the ends of the bones, okay, and you can see the inner layer, that's a areolar tissue, will be producing a viscous fluid, and that is called synovial fluid. So this is the synovial fluid, okay, so filling the synovial cavity. So that acts as a lubricant, okay, and helps in the free movement of the joint. So out of this we will see different types of these synovial joints. So here under the synovial joints, so the first one we'll see is ball and socket joint. Ball and socket joint. So here the ball and socket joint, you will see in case of this hip joint. So this is the one that is present between the femur and pelvic girdle. Present between femur and pelvic girdle. And another one called the shoulder joint. So this is present between humerus and pectoral girdle. Okay, so almost all the synovial joints will have the same structure which I have shown just now. So the next one is a hinge joint. So this hinge joint you will see in case of elbow. So elbow joint, okay, then even the knee joint will be also we call it hinge joint. So this hinge joint will allow movement, okay, to certain extent, right. Then the pivot joint. So pivot joint. So coming to this pivot joint, we find this one in between atlanto axis, okay, or axial joint. So it is present between, okay, atlanto axial joint. The next one we have is gliding joint. Gliding joint. So this gliding joint is present between between the carpals. I say intercarpal joint. So also called intertarsal joint. Also called intertarsal joint. And one more we have is condyloid joint. So this condyloid joint is present between, okay, carpals and metacarpals. Then another one, the condyloid joint is also present between the occipital condyles, and the first vertebra of the vertebral column, that is atlas. So these are some examples of these synovial joints: the ball and socket, hinge, pivot, and gliding, and condyloid joints. So just I will show you of pictures of this. So here I show you different types of joints: the gliding, okay, the gliding joint, the hinge joint, pivot joint, and even you can see ellipsoidal joint. Then there is a saddle joint and the ball and socket type of joint. So you can see the pictures on this side how the ball and socket type of joint will be seen. Okay, in this case the saddle joints you see here. Okay, and okay, between this is an ellipsoidal joints. Okay, in the you will find in case of the wrist bones here, and then pivot joint between, you can see the atlas and axis. Okay, so you can see the pivot joint between atlas and axis. Okay, so this is where I have mentioned a pivot joint, atlanto-axial joint. Okay, then you can see the hinge joint. So this is how the hinge formation, so that will not allow so here this one stops the ulna from moving, okay, all around, and only you can straight your hand, but you cannot bend it back. Okay, but you can fold it. So here you don't have, so this in this direction you can go, and only so to this extent maximum you can stretch the hand. Then next the gliding joint you can see here. So these are all okay, different types of synovial joints. So the next we'll see about the disorders of muscular and skeletal system. So disorders of muscular and skeletal system. So coming to these disorders of the muscular and skeletal system, we have is myasthenia gravis. Okay, so in short we'll write it as MG. So this myasthenia gravis is a long-term neuromuscular disease. Is a long-term neuromuscular disease. Okay, and this will take it as a autoimmune disorder. Is a autoimmune disorder. Okay, and this one actually affects neuromuscular junctions. Affects neuromuscular junctions. We know the neuromuscular junctions are the junctions between, okay, the neurons and the muscle. So you can see here the tips of these neurons will be present on, okay, the sarcolemma. So you can see here this is the, okay, muscle fiber, and these are the synaptic knobs, and this is the neuromuscular junction. Okay, so here what are the symptoms of this, the myasthenia gravis? So it includes okay, weakening and paralysis of skeletal muscle, and paralysis of skeletal muscle, and it also seen with the fatigueness. Okay, right. So here, what could be the cause here? So the cause for this myasthenia gravis is that the antibodies will block or destroy, okay, these acetyl choline receptors. So they block or destroy acetylcholine receptors, okay, at the junctions between the nerve endings and muscles. So because of this, the impulse will not reach the muscles, and that results in failure of responses by the effector organs. So that's the reason in case of myasthenia gravis. Okay. Then coming to the treatment, so there is no treatment in this case. Only some immunosuppressants may be used to reduce the symptoms. Okay, so that's about myasthenia gravis. The next one about muscular dystrophy. So the next one, muscular dystrophy. So coming to this muscular dystrophy, this is a progressive degeneration of skeletal muscle. It's a progressive degeneration of skeletal muscle. So this muscular dystrophy is a genetic disorder. So under this we have is DMD. So there is a disease. This is called the Dutch-knee muscular dystrophy. So this is that comes under muscular dystrophy. So DMD, okay, is a genetic disorder. Okay, so the next one we'll see about tetany. So coming to this tetany, so this is what we call the muscle spasms. Okay, so that will be prolonged contraction of muscles, prolonged contraction of muscles. So this may be caused due to so the cause is due to low calcium levels. So caused due to low calcium levels in blood, and then then even the underactive parathyroid glands, underactive parathyroid glands, that results in a hypoparathyroidism. And also due to deficiency of vitamin D. So that's about the tetany. And coming to another one, arthritis. So this is simply the inflammation of joints. Okay, so this the causes are not known properly. Okay, then next one is osteoporosis. Coming to this osteoporosis, we know this is a age-related disorder. Okay, and this is characterized by the loss of bone mass. Okay, So uh, so here this is especially the loss of calcium, the loss of calcium due to absorption, loss of, okay, calcium due to absorption. Okay, I mean reabsorption. So due to reabsorption, okay, from the bone, the mass of the bone decreases. Okay, so this will result in easily fracture of the bones. Okay, uh, again there is another reasons like a decreased level of estrogen can also decreased levels of estrogen. So decreased levels of estrogen, okay, that you will see mostly during the menopause time, is a common cause of this osteoporosis, and is seen uh, very much frequently in women than in men. And lastly, one more we have is gout. Okay, so this is again inflammation. So gout is an inflammation, is inflammation of joints, is inflammation of joints. Okay, this is due to accumulation of uric acid, caused due to accumulation of uric acid. Okay, fine. So that's all about the locomotion and synopsis. With this, okay, we finish the synopsis. In the next session we shall see about uh, the objective on locomotion and movement.